Hello students, today we are going to talk about ligaments of knee joint. This is the OSPE, that is Objective Structured Practical Examination. First question is X, identify the joints. Now so look at the left slide first. This is femur, that is tibia. This space between the two is what is asked, and this is a space of knee joints. This is a knee joint. Name the intra-articular structures and intra-articular ligaments which we will cover as we go along. Now, name the ligament which is marked in red. This is a ligament marked in red. This is anterior cruciate ligament. And the one which is marked in blue, that is a posterior cruciate ligament. Their attachment we will discuss as we go along. So, what are the intra-articular structures of knee joint? They are anterior cruciate ligament, posterior cruciate ligament, meniscofemoral ligament, tendon of popliteus muscle, and medial and the lateral menisci. Today we are going to talk about cruciate ligaments only. So what are cruciate ligaments? They are powerful interosseous ligaments. Interosseous meaning between two bones. So they are going between tibia and the femur. So they are interosseous ligament, and they are inside the joint, in the interior of the joint, and they are more posteriorly placed than anterior. They are so named because they are crossing each other like the letter X, and they cross obliquely, and that is why the name cruciates. Now the anterior and the posterior names, they come from their tibial attachment. So if it is attached anterior to the tibia or anterior in the tibia, then it is called anterior cruciate, and similarly it will be posterior cruciate. Now these ligaments, they are important because they prevent the anterior-posterior movement of the tibia and the femur over each other, and also the medial and the lateral, that is abduction, adduction, and they prevent rotation also. So now this slide again is seen from anterior-posterior. Here is the anterior cruciate ligament. This is tibia. This is tibial tuberosity. So it is going from near the anterior portion to the femur, and it is traveling upwards and laterally, that you can see in this figure. But it also travels posteriorly, that we will see later on. This is the posterior cruciate ligament. It is placed more posteriorly compared to this anterior cruciate ligament, and it is going upwards and towards the medial condyle of the femur. Now attachments. So now look at the tibia. This is anterior end of the tibia. This is tibial tuberosity. This is a tibial plateau, as we call it, that is the upper surface. Now on the upper surface you have this medial articular area for medial condyle of the femur, and this is for the lateral condyle of the femur. These areas are articular areas. Between these two articular areas, the non-articular area is called as intercondylar area, which is all this. Now attached to the intercondylar area are the two cruciates which are marked in green. The one which is placed anteriorly near the tibial tuberosity, this is called as anterior tibial cruciate ligaments, and this is posterior cruciate ligament. So that is why we say that they are named anterior and posterior due to their attachment on the intercondylar area of the tibia. This diagram is showing you the same thing, but it also shows something else. This is now the anterior cruciate, because this is a tibial tuberosity, that is posterior cruciate, and this pink thing that you see is actually the synovial membrane. So we call that these ligaments, cruciate ligaments, they are intra-articular, that is inside the joint, but extra synovial. Extra is outside, so they are outside the synovial membrane. You can see here the synovial membrane is only covering it from these sides but not taking it in. So they are intra-articular and extra synovial. You can see a slightly enlarged image. This is synovial membrane. This is the tibial tuberosity, anterior cruciate, posterior cruciate, and they are inside the joint but outside the synovial membrane. So now the femoral attachment. So this is right femur, posterior surface. This is the lower end, which this is a medial condyle, and that is a lateral condyle, and this area is called as intercondylar area. So the cruciate ligaments are attached to the intercondylar area of the lower end of the femur. Here you can see This diagram slightly enlarged lower end. This is the medial condyle, that is a lateral condyle, and now this is the intercondylar area. And here you can see the same thing. Now see the attachments. This is PCL, meaning posterior cruciate ligament. It is attached more anteriorly near the medial condyle of the femur, while ACL, or the anterior cruciate ligament, is attached more posteriorly. This is the posterior surface, and to the lateral condyle of the femur. Here little better diagram. This is lateral condyle, and here you can see the anterior cruciate ligament, and here is medial condyle. So here you get the posterior cruciate ligament. Remember, posterior cruciate ligament is attached anteriorly and anterior cruciate ligament is attached posteriorly to the femur, exactly opposite of how it was in the tibia. So now let's take the anterior cruciate ligament. So it is weaker of the two and it has got poor blood supply. What is the direction? It is attached to the anterior intercondylar area of the tibia. From there it travels upwards, backwards and laterally. Here you can see it is going laterally and upwards. Backwards you will see in the next diagrams. Posterior cruciate ligament is attached to the posterior intercondylar area and it goes upwards and medially. Upwards and medially, but it also goes anteriorly. So we will see this next figure. So here you can see this is the anterior cruciate ligament. This is tibial tuberosity, so anterior end, and from here it is going towards the posterior side that you can see. And this is the posterior cruciate ligament, which is from the tibia posterior side. It is going upwards to the anterior part of the femur. Now this is the anterior cruciate ligament. In this diagram you can see that they are crossing each other like an X, but here you can see the direction that the anterior cruciate is going upwards and backwards, while the posterior cruciate is going upwards and forwards and to the opposite condyle, that is anterior is going to the lateral condyle, posterior is going to the medial condyle. So the posterior cruciate is the stronger of the two, and from the intercondylar area we have already done that. It is going upwards, forwards and medially to the femur intercondylar area attached near the medial condyle but more on the anterior side. Now anterior cruciate ligament prevents the anterior sliding of femur over the tibia, especially when the knee is flexed and weight bearing, as when you are walking downstairs or downhill or even crouching. It is the only stabilizing factor there. So now this diagram will explain. Now this is posterior cruciate ligament coming from the posterior side of tibia but going to the anterior side of the femur. Now then this knee is flexed and we will suppose that this is weight bearing. So what it will do is that femur in this position can easily slide off in this direction anteriorly from the tibia, but it is prevented because of the posterior cruciate ligament. And the anterior cruciate ligament will do exactly. Okay, now pay attention here. Anterior cruciate ligament will come into force when the knee is extending. Okay, so now this is the flexed femur. Now the femur is going to become straight in extension. When the upper end goes straight like that, the lower end of femur will go backwards over the femoral surface like that. And if anterior cruciate ligament is not there, the femur can move backwards posteriorly. So that is prevented by the anterior cruciate ligament. So we say that the anterior cruciate ligament, it resists the posterior movement of the femur over the tibia. And the posterior cruciate ligament, it prevents the anterior movement of the femur over tibia. Now both these joints, they will resist the rotation of the tibia over the femur. Also both of them prevent the medial and the lateral movement or abduction and adduction of the knee joint. So now these are the functions of anterior cruciate ligament. It prevents the backward dislocation of the here. It prevents the backward dislocation of the femur over the tibia, as in extension. It limits the hyperextension, but it allows a movement which is called as locking of the knee joint. The posterior cruciate ligament, it prevents the anterior displacement of the femur over the tibia, especially in the flexed weight-bearing knee, and it prevents the hyperflexion of the knee joint. It is the main stabilizing factor of the knee joint in a weight-bearing flexed knee, and it stabilizes the femur. While the anterior cruciate ligament, it prevents the posterior displacement of the femur over the tibia, and it prevents the hyperextension. So now if the cruciate ligaments are damaged, what you get is that excessive movement, gliding movement of the tibia over the femur, either forwards or backwards depending upon which ligament is damaged. And there is also more movement of abduction and adduction. Anterior cruciate ligament, being weaker of the two, is more often injured, and the physician performs something which is called as a drawer's test to find out the functions of the knee joint and whether they are torn or not. So now, to test the anterior cruciate ligament, we do what is called as anterior drawer's test. So when the joint is flexed at right angles, the tibia cannot be pulled forward not more than 6 millimeters because it is held by anterior cruciate ligament. So the anterior drawer's test of the knee assessment, doctor uses to check the anterior cruciate ligament. So now it is done in the normal knee first, and then the injured knee is checked to find out the difference between the two. Now how you do it? So here you can see the patient is lying on the surface, knee joint is flexed 90 degrees and the foot is flat on the bed. The examiner sits on the toes of this patient to stabilize the leg. Then he holds the lower leg just below the knee joint, and now he will pull it anteriorly in this direction. Normally this movement is prevented. If tibia is pulled anteriorly, the femur will go posteriorly. So now this movement is just 6 millimeters. If this movement is more than 6 millimeters, that means anterior cruciate ligament is either damaged or loose. And in posterior cruciate ligament, the same position, but the hand which is holding the upper part of the leg is pulled backwards, like in this arrow. So the examiner pulls this tibia posteriorly. If there is excessive movement, then the posterior cruciate ligament is torn. If you have any questions, please put them in the comments. I will answer them through another video. Also, please use your headphones to listen to this video. Thank you.